I'm Professor Martin Brickwell, Professor in Conflict Health and Military Medicine. And this presentation is a summary of the development of new teaching resources by the King's College London Centre for Military Ethics. And the presentation is given on behalf of Professor David Whetham, Professor of Ethics and Military Profession, and Dr. Marina Miron, Visiting Research Fellow, both also at the King's Centre for Military Ethics. So the teaching of ethics in the military is an important part of the education at the Joint Command and Staff College at the UK Defence Academy. And this is taught by members of the Centre for Military Ethics that's part of the Defence Studies Department of King's College London. And the material taught is a combination of reference material hosted on the website Military Ethics UK, self-directed learning material, also hosted on the website, and playing cards that are both available on the website and also as physical playing cards. And one of the innovations that has been developed is these playing cards that can be used in small group teaching to enable discussion of scenarios and showing how this improves attitudes and behaviours of military personnel. It can also promote an element of psychological resilience because you can pre-rehearse some challenging issues that you might face on military operations. And this has been shown to be an effective way of communicating issues in military ethics. And as an example, this slide shows some of the results from using this teaching resource in teaching military ethics to members of the Colombian Armed Forces. And from the courses developed, which includes the uses of the cards, over 90% of Colombian Army officers who had been involved in this education had agreed that it changed their perception on the use of lethal force and helped them to abide by the rules of engagement in place in their country. Military medical ethics could be considered as a fusion of the two professions of medicine and the military. And in medical ethics, this is regulated by healthcare professional bodies such as the General Medical Council, Nursing and Midwifery Council, and the Health and Care Professions Council in the UK. Military ethics, as discussed, is the fusion of international humanitarian law and Geneva Conventions and the laws of armed conflict. And the two together is military medical ethics. The most important recent document is the one shown on the slide, which is the Ethical Principles of Healthcare in Times of Armed Conflict and Other Emergencies, that has been co-published by a number of international bodies, including the World Medical Association, the International Committee of the Red Cross, and the International Committee of Military Medicine. And this document divides military medical ethics in times of armed conflict and other emergencies into 4 areas: principles, professional duties, patient primacy, and the protection of healthcare workers. Now, teaching military medical ethics, we wanted to use the similar structure to what's available to teach military ethics, but add in a 3rd dimension. So we have a website, and this is developing into a collection of electronic resources to support education in military medical ethics, some cards on military medical ethics scenarios, similar to the ones used to teach military ethics scenarios, and these are designed particularly to facilitate small group teaching. And the 3rd dimension is an app, which is built around the cards and is designed to support self-managed learning and also small group teaching by taking away the physical requirement for the cards and putting it onto devices that are commonly held on smartphones. So in developing the cards, and particularly developing the scenarios that are on the cards, we went through a series of phases in this methodology. Firstly, we collected data both from published information and also key informants from a number of organisations, and shown on the slide. And through a combination of survey and discussion, we identified the topics that we needed to cover in the scenarios for our playing cards. And these were divided into 4 suits. Clubs, the principles of healthcare. Spades, relationships with patients. And hearts, protection of healthcare personnel, similar to that document I showed on the previous slide. And the final suit covers teamwork, communications, and culture, as these are so important in setting the conditions for military medical personnel to practice ethically. From that, we then developed questions to cover the scenarios, and we also looked at translation of these scenarios into different languages, particularly Arabic and Spanish. So what we have found in the first phase, which was the use of the cards, is that they're very helpful for small group discussion. It's essential that there's some common core knowledge that's imparted to students before you use the cards. And it's also important to be able to adapt the scenarios and the discussion around the scenarios to the context of the particular target audience. But definitely they've been shown to facilitate discussion in small groups and shown through feedback to influence attitudes after using these as an educational tool. So we're now in the stage of turning this into an app. The advantage of an app is it keeps familiarity of the format of the cards, but it also allows us to put more material available in support of individual learning. And once downloaded, the app can be used by the students in a number of different educational scenarios. And with the app linking back to the website, the app can be automatically updated every single time the phone is connected to the internet and the app is relaunched. So it's definitely an additional asset in teaching for this particular topic. The way in which the app is designed is that there's a home page shown on this slide, which covers a number of features. First feature is a random card. It allows the user just to click and any one of the 52 cards is presented in a group of 4. And this can be useful particularly in small group teaching where you can ask a student to select a random card and then everybody else go to that card. It's also possible to identify favorites. So an instructor could have a number of cards that they know works well for the particular teaching scenario, and they can click on the card, use that, and ask the students to do that as well. There's some information about the app, including an important disclaimer. And then there's the suite of cards as previously described against each suit. There's also a set of jokers, which are there to provide key principles and supporting material for background reading. We will translate them in cards into Arabic and Spanish, and certainly as part of the rollout, we're very keen to build relationships with partners who would help us adapt these cards for different contexts. And finally, there's a feedback page. So if you look at the cards themselves, each card shows a scenario ready for discussion. And then if you click the Learn More tab, there is a structured framework of supporting material to enable somebody to either self-learn from their thoughts on that scenario or for an instructor to take the group through discussions around the key references, reviewing the question, interpretation of the principles and policy from the reference, and then a framework for answering the questions. We've also included some further issues that could be considered as part of the discussion on that topic, and some links to further reading. The feedback page will take you to links to 2 surveys that can be completed online electronically. The first is a feedback on the app itself, and we're asking for feedback on the design, the content, and further ideas. And the second survey is feedback from instructors using the app or the cards in an educational setting. And we're particularly keen to understand different ways in which you can design an educational activity to include the use of the app to reinforce learning. And so that might be through formal lectures, self-directed learning, small group discussions. Particularly this presents the opportunity perhaps for creating online educational settings whereby using video conferencing software, for instance, the instructor might ask all the students to click to a card, and then you can run online some different feedback and discussion topics. So we're definitely interested in experimentation in different educational settings that use one or all of the different components of this educational suite: the app, the cards, and the website. So how can you access the app? At this stage in development, it's only available for use on Apple smartphones and tablets because of the need to get it right before you then translate it into other operating systems. And so we're using a software application called TestFlight. If you click on the link shown in this slide, that will take you to the website that will allow you to then download the app from the iOS App Store. And then you install the app TestFlight, and then you open the Military Medical Ethics application. So you have two apps on your phone. And it's the Military Medical Ethics application that's the beta version that allows you to utilize the app itself. And why is this so important? Well, ethical practice is vitally important in medicine, both for clinical decision making and also for organizational decision making. And it's really important as a foundation to support healthcare workers in circumstances of significant psychological distress. And as presented in this paper from the Journal of the Royal Army Medical Corps, now BMJ Military Health, there's a very clear operational priority for military healthcare professionals to understand military ethics. So on behalf of the three of us, thank you very much for watching this video. We very much hope that you will download the app and provide us feedback on the beta version prior to us completing the project and being able to launch the app for use on all smartphones.